Hello everyone, I'm Dr. Nishana, now working as a senior resident in anesthesiology. If you're someone who's interested in taking anesthesiology as your specialty or is considering anesthesiology as your specialty, you are welcome to this video. I'm someone who took anesthesiology as my postgraduate specialty with a lot of interest, but I didn't even know some of the things related to it. Even though I was very much interested, and I have discussed about it with so many people who had already done anesthesiology, but there were these things after getting into residency I came to know about that are not much discussed. So I'm discussing a few things that I wish I had known before taking anesthesia as my specialty. So we'll discuss it in under different headings. Thing is about the interest and aptitude. If you're interested in anesthesiology, it's well and good, but during the MBBS days we are very less exposed to anesthesiology. It's usually a 2-week posting during the MBBS period and around 2 weeks posting and the house urgency. So we are very less exposed to anesthesiology as a subject, and it's usually a very chill posting in some of the institutions. Few people will bunk that, and we most commonly does not understand what is going on around. Most of the anesthesiology information about the work of anesthesiologist is through reels and social media posts, where you see the anesthesiologist chilling in the operation theater behind the screen, where the surgeon is working hard and the anesthesiologist is working hardly using his phone or something like that. But it's not usually like that. It's the nature of work is like that. Most of the time it's chill, but it looks like it's very chill, but it is a bit of high stakes, high responsibility work. We are taking care of the patient while the surgeon is concentrating on the surgical side. If you're someone who loves anesthesiology or someone who is very much interested in physiology, learning a bit of pharmacology and a little bit of physics, it's a very good subject. We learn about physiology in the normal condition, physiology in various conditions, and how anesthesia and anesthetic drugs, that's pharmacology, affecting the normal physiology, and in a bit of medicine where how diseases are affecting all this normal physiology and how can it affect the pharmacology and how pharmacology is affecting. So it's a bit of physics, pharmacology, medicine, and if you want to be a jack of all, it is a very good subject. Some people may feel that there is only a very less to learn in anesthesiology because it's a very small subject, but it's not like that. We have a lot of theory to learn, and we have a few procedures. We have only few procedures, but we need to master those because they are critical procedures, because we are doing intravascular cannulations. First of all, it is IV cannulas. We do IV cannulas, but the other cannulations, central vein cannulations, they're all very large vessels, important vessels, and we do procedures in the spinal cord. So all of them are very high risk procedures. We have only few, but they all require a lot of procedure skills. But don't worry about it. You will be good by the end of your training. Usually the anesthesiologist work is confined to the operation theater or the ICU. So we usually work under closed environments. But if you're someone who doesn't like that, wants to run around the hospital, it's not for you. But don't think because it is in a closed space it's going to be boring. No, inside the operation theater and inside the ICU we live like a family, or the nurses, the technicians, the surgeons, and the whole team in the operation theater or ICU is working together. So it's a very much team-based job. We are usually not the persons who bring people to the operation theater or hospital. It's usually the surgeon or the admitting doctor in the ICU who brings the patient into the hospital. We usually help them to get through some difficult phases, like during the surgery or during the stay in the ICU. So it's very much team based. If you love those working as a team collaborating with different specialties, surgical specialties, medical specialties, knowing about all those and interacting with them. It's a very good specialty. But the thing is that even if you do a lot of things, collaborate, work, we usually work behind the screens. Once the patient is out of the operation theater or out of the ICU, you will not get any credit for doing something for the patient in most of the institutions, except few where anesthesiologists are recognized by the patient and the managements or the hospital authorities. So if you love that, getting those credits or getting those thank yous, it's not for you, because most of the time we are invisible to the patient as well as the authorities. So that's it about the nature of work. Most of the people choose anesthesiology considering it will have very good work-life balance, but I also thought like that, not the word thought. At least during your residency, it's not going to be a very good work-life balance thing, because during residency you will have duties, night duties, emergency cases going on, you will be stuck up doing PACs. So I don't think it's going to be a very chill, relaxed residency unless you are doing it in a very low volume center. In that case, you will have to work harder once your residency is over. So at least during residency, it's not a very good work-life balance, unlike many people think. Another thing is, after residency, it's your choice of having the work-life balance. If you want work-life balance, you can choose those hospitals like medical colleges or low volume centers where you can work and you can have a life also. In most of the corporate setup, if you're choosing to work there, most of the time you will have a very good pay, but you will have to compromise on work-life balance. If you're going to be a freelancer, in addition, if you're going to work like that, you will have to compromise your time. The thing is that if you're choosing work-life balance more, you will be paid less, and if you want a good work-life balance, you will have to compromise on the pay. That's it. But the thing is that you can always choose. There is an option to choose. Next is about the scope after doing anesthesia and the rumors of saturation. So we have a lot of career options after doing anesthesiology. You can work as a general clinical anesthesiologist in various hospitals. Another option after anesthesiology is doing critical care. Those people who love critical care and who cannot take medicine because of their rank issues in NEET PG, they can choose anesthesiology and then go ahead with intensive care if you want to do so. Then we have various fellowships and super specializations in anesthesiology, like cardiac anesthesia, neuro anesthesia, pediatric anesthesia, onco anesthesia, trauma, and regional anesthesia. There are a lot of super specializations, and doing those super specializations will help you get better opportunities as well as a better pay. And if you're planning to get into a specific niche, you can do that. And the rumors of saturation, that's everywhere the anesthesiologist is required, but the thing is that some of the rumor is true. In top cities, there is a bit of saturation because there are a lot of more number of seats in anesthesiology compared to other specialties now. There are MD seats, DNB seats, and the NB has started diploma seats in anesthesiology. So a lot of people are coming out as anesthesiologists, and there is a bit of saturation. But in lower tier cities, rural areas, there are opportunities, and in top tier cities you can always work as intensivist. As far as I know, there is always vacancies for intensivist going on everywhere. I think Now it's not saturated, but it's going to get saturated. The field is getting more competitive now. And another factor contributing to this is earlier most of the people were not choosing anesthesiology, considering it is not a good option. But after COVID, I think many are choosing anesthesiology with interest, seeing the scope, seeing the intensivist role. But I think even though it is going to get saturated, in a lot of places there will be opportunities, and if you're someone with high drive and do well in your subject, you'll always have options. Next thing is about the income. As I've already mentioned, we don't bring patients to the hospital. It's the surgeon or the admitting physician in the ICU. So usually the authorities think we need to be paid on less, even though we do a lot of work. So it's always less than those surgical fields and physicians, but it's decent. And if you choose to work in large corporate hospitals, or if you do freelancing, and if you spend a little bit more time, you'll be able to earn even more than them. So it's about the choice of work-life balance, the centers you are choosing to work. So initially it may be lesser than all these specialties, but later as you go on, you might be paid a lot more than what you get paid initially, but it's always less than all those surgical specialties. And another thing to consider is this surgical specialties, medical specialties have their scope of working independently. But except for pain clinics, we won't be able to work independently. We are always hospital or center based. So that's a con. Another thing is about the super specialties. Pays in super specialties are higher than those in compared to the general anesthetist. But you have to learn more years, maybe requiring to work more, because in all those centers there might be only a group of few people who are doing those super special cases like neuro, cardio. So in case of emergencies or any problems coming up, you will have to stay back longer, because there won't be any other super specialized people in the department. So that's a thing. Next thing is about choosing your training center. So you have to look for the case volume or case load in the hospital. It should be higher, because you need to get exposed to many cases and variety of cases during the posting. And if it is not a place with super specialties like neuro, cardio or ICU, a proper ICU, you have to look whether they provide any distant postings in other centers with good volumes of these cases, that cases you don't get, or the ICU exposure. If it is there, you can join. Then you have to look for what kind of technology they are using, they are updated, or whether they are using the very good old boils machine, the inhalation agents, the drugs, they are using a good UST machine, because right now it's standard to conduct all the nerve blocks or the vascular cannulations and all under UST guidance. So UST, use of UST with ease, focus, everything is becoming a standard for anesthesiologists. That is a bare minimum for anesthesiologists to know in the coming years. So you have to see whether they have a good UST machine, whether they are doing cases using that. Another thing to look for is the academics the department is providing. If they are conducting classes regularly, journal clubs regularly, whether they are allowing their residents to go and participate in various conferences, events related to that, events related to the anesthesiology societies, etc. If they are providing all those, it's very good center, you can choose that. If you're interested in knowing how to choose a center or differences between doing a DNB or MD, comment below. I can create a video on that as well. So these are the things you should consider before choosing anesthesiology as your residency. So I'll summarize all the pros and cons here. I think think you have got some value from this video. And if you want more videos related to anesthesiology as a subject, the residency, choosing MD versus TNB, or getting through your residency in anesthesiology, you can contact me through my handles listed in the description. So thank you for watching this video till the very end. See you in the next video. Bye.